Hello, I'm Dr. Basil Considine. I'm here from the ACU Online Writing Center, and today we're going to be talking about writing and defending a patient's Bill of Rights. Now, patient's Bill of Rights have been around in the United States for 50-something years in different shapes and forms, but they gained a special currency, a special prominence when they were codified into law, at least in part, by the passage of the Affordable Care Act and the implementation of certain provisions. And since then, they become an important way of medical organizations and other public health serving things to convey attitudes, expectations, and responsibilities. So let's talk about what those are. Because of where we are in the semester, we're just going to dive straight in, and I will simply point out that we do have on our webinar page this tabbed guide where you can see all the course tie-ins with your specific program. So if you're taking the APCO course sequence, take a look and see what we have for your class. You'll see me using the a course paper template listed on this slide. And with that, our main objectives today, we're going to first look at the Patient Bill of Rights genre. We're going to look specifically about this assignment for APCO 422, the Patient's Bill of Rights assignment, talk about how to cite key sources, do a little review of some relevant regulatory code, and finish with a discussion on outlining and drafting. So, Patients' Bills of Rights. As I mentioned earlier, these have been around for a good long time. The first major one is usually said to have been passed in 1950 or implemented in 1950. But understanding the concept that the physician or the medical organization has responsibilities is very, very old. Just think back to the Hippocratic Oath, do no harm. Now, the codification reached a special intensity, a special need, and special importance in the last decade or so as parts of the Affordable Health Care Act were implemented in the United States, requiring that these be spelled out and communicated. And in many cases, they need to be updated as different regulations continue to be added, implemented, interpreted, etc. So if we look at what a Patient Bill of Rights is, let's take a look at what one healthcare organization says. So this is Navicent, which is a fairly large provider. And they say that their Patient's Bill of Rights was created to try and reach three major goals. First, to help patients feel more confident, to stress the importance of a strong relationship between patients and their healthcare providers, and to stress the key role patients play in staying healthy. Now, each of these points is elaborated to a different extent. But if we look at this, this is kind of spelling out a philosophical approach and a basis for dialogue. So if we break down number one, assure that the healthcare system is fair and works to meet patients' needs. So that's one of those things that suggests that, if there's a bureaucratic block, that's not the patient's fault. Okay, what should you do in that case? And lean on the side of meeting patients' needs. All right, give patients a way to address any problems they may have? Yes. Knowing how to resolve a problem is often more important than the existence of the problem itself, because the problem could be very cursory or it could be very obstructionist if you don't know how to proceed. Encourage patients to take an active role in staying or getting healthy. Yes. Knowing what you can ask for, what you can get, what you're entitled to. Not entitled in the arrogant, yelling at people way, but like, hey, I'm a human being. I deserve these things. You've agreed that I deserve these things. Could I get them, please? And to improve the importance of that relationship, to bring out that relationship between patients and healthcare providers. So many studies have found that when people trust their doctor, their nurse, whoever their primary care provider is, they listen to and follow the advice and instructions much better. And then laying out the rights and responsibilities, not just of patients, healthcare providers, insurance plans, in some cases. So that's all important stuff, and if we understand and agree on those, it makes many things potentially easier. Let's take another look. This is coming from the American Cancer Society. They explain the purpose of a Patient's Bill of Rights as being designed to empower people to take an active role in improving their health, including making informed decisions, Now, this might seem a odd inclusion, but for many years, and in some parts of the world still, it is a common practice to withhold information. The classic example, if you watch movies from the 1950s and 1960s, oh, you have a terminal you have a terminal disease, but we're not going to tell you. We might tell your spouse, but we're not going to tell you that you're going to die. And nowadays in the United States, we're like, well, they kind of deserve to know. But this is, again, spelling out expectations that, oh, yes, you are empowered to make an informed decision, which means that there's certain things you have the right to ask and to be told and everything, and to specify in advance, like end-of-life care. Strengthen the relationships that patients have with their healthcare providers. Yep, as we discussed earlier, that's very important. And patients' rights with insurance companies and other things involving payment. Yes, that is a source of so much stress, so much drama, so much, unfortunately, yelling. So, these are all things that can go into why you would want to have a patient bill of rights, besides legal obligation, and that are very helpful to have as a framework for conversation. So with that, let us take a look at this specific assignment from APCO 422. So this is coming from the Ethical Implications of Healthcare Policies and Regulation course. Now, the assignment description begins with a preamble, asking you to reflect upon a patient's rights and responsibilities while receiving healthcare services. And we have some reading and the acknowledgement that, there is not actually a universal patient bill of rights that is accepted around the world, or even all around the United States. There are some things that kind of approach it, but nothing that's exhaustive. So your assignment is to create a patient bill of rights that includes at least 10, and you can use examples that you've used. You are not prohibited from including something just because it's listed an existing one. But if you are taking it from another thing, acknowledge your source. Include citations or descriptions of that, this was derived from this thing. And so you're not only writing the list of rights, but also a paper justifying it, summarizing why you made these choices. And this should be 300 to 500 words, so it's a little bit over 1 page to 2 pages, plus the cover sheet, the reference list, and you should have at least 3 scholarly resources. If we look at the rubric, it looks like a lot of information, but that actually distills pretty well into these 4 points. So, did you create a Bill of Rights that had at least 10 rights in them? And that you included 10, if you have 8, you're not going to get full credit. That you have reasoning justifying these inclusion. And that it's well written, within the parameters, has all these components. So most of this is, have you written those 10 rights and justified it, and the rest is, okay, is it decently well polished and clear communication and APA style and all that stuff. So let's talk about the sources, because it does mention that you need at least 3 references. Well, if we look at the readings for week 2, we have, of course, the main course text, Law and Ethics for Health Professionals, coming back, which you can cite as did before. We have this article here. Now, P&T, some journals have an abbreviation that's used commonly, but the full name is actually spelled out. This is one of those cases. The journal is named Pharmacy and Therapeutics, a peer-reviewed journal for formulary management, which is a bit of a mouthful, but the only place you need to have that is in the references list. Everywhere else it's going to be just author date, so not a big deal. That PDF from the perspective is just a course handout. It's not a published document. The Texas Administrative Code. So if you are not familiar with this, if you turn to page 355 in the APA 7th manual, you'll see the guidelines for it. But if you want to cite this specific administrative code, then here's the reference information, and here's how to cite it. If you want to cite this, what are my healthcare rights and responsibilities, that is a web page with the date on it. The date is down at the bottom, and it's published by the U.S. Department of Health and Human Services, which claims corporate authorship. Hence, it's listed as the author there. And that would be cited like that. Now, if you are going to be using this a lot, you might introduce an abbreviation for that, but that's not required. So that Texas code that we looked at here, that is actually well worth looking at for a couple reasons. Because this includes detailed description of patient rights. And if you count it up, you happen to have a count that is quite close to what this assignment is asking you to do. So if you are looking for a patient bill of rights, it's helpful to start with the question of, well, what does your legal jurisdiction require? Like, what does the law say you must have? And then see what you have left over. Are there additional things you want to state? Are the additional things that you believe must be included or should be included? But start from the, yes, we are legally required, and you'll see that this is coming from health services, hospital licensing, operational requirements. Yeah, that sounds like something that you really, really do want to have in your Bill of Rights. So it doesn't need to be in the same level of detail or the exact wording that is here. No, this is written as for legal code. You might choose to make your wording more customer-friendly or more patient-friendly because lawyers tend to think a little different than doctors, and doctors tend to think a little different than patients. And who is this for? If it's the patient Bill of Rights, it should be accessible to the patients. So there are all these different rights enumerated here that should be included. And you'll see on this one, there's a note. The hospital patient's Bill of Rights should be prominently and conspicuously posted for display in a public area that is readily available. And if we look at this, that tells us that something about the usability, because if it's a huge, long piece of text, then prominently and conspicuously posted word vomit is not going to be helpful. So there's certainly a value to having this be concise. And you can look at that more. Let's go ahead and head over to drafting. So grab a copy of the AP course paper template. So I have here a copy of our AP course paper template, and I've just started filling in the title here. You can fill in all the rest of the information. But let's start by looking at what we're being asked to do here. So I'm going to just take out all this placeholder text. I'm going to take out the placeholder references. These are just to show you the formatting. All right, now I'm going to start by copying and pasting the assignment instructions. So looking at this, we have the instructions, and it's written in paragraph format. And what I want to do is have a task list, a list of what goes where. So I'm going to reformat this. And first off, I'm just going to italicize this so I can see this is from the instructions, not something I'm adding first. So first off, I'm going to add my introduction. And then here, we have right now essentially 3 tasks. Introduce what we're writing about, create the Bill of Rights, and write the paper summarizing the rights. So let's check that rubric and make sure we've got everything. And we have, okay, created the patient Bill of Rights and explains the reasoning. Yep, that's basically it. Okay, so let's go back. So how would you introduce this? Well, I'm going to suggest that since there's no universal patient Bill of Rights, tell us what you're writing for. So that could be geographic context, could be an institution. I'm going to pick one at a hospital that many of my students have worked at. So I have as my introduction so far. The proposed Patient Bill of Rights was designed for the Texas Institute for Robotic Surgery at Medical City, TRS, a small medical provider specializing in minimally invasive surgery in the Dallas-Fort Worth Metroplex in Texas. So I've specified an institution and a geographical area and the state that's regulating this. Are you required to have all this? No, but it's a helpful way of orienting the reader and to lead into justifying why I'm going to have these things here. Now, I could give another sentence or two of history about this, or patient size, or special things that might involve this. And so I'm just going to give myself some notes there to add that. And then going to list here. And here, I'm going to just start filling things in. So you need to have at least 10, so I've created 10 spaces here. And then you can add them as you see fit. Let's say that I add this. The patient has a right to be informed in advance of all anticipated charges. Now, again, there are many different reasons why you might structure your Patient Bill of Rights to have one thing before another, but at this stage you're just trying to make sure you have at least 10, and then you can always reorganize them by dragging these around later, as you can see me do here. So that is a relatively easy reorganization to do, but start with getting your list there. And once you have 10, now you can start looking at what's the justification for those. And once you end up at the final order, then you can start moving down here and plugging in, oh, right number 1 was selected because of X. So if I'm referring to the legal obligations, I can cite that. Now, one of the things on this slide is we have the third from the bottom in this list. A hospital shall have in place a mechanism to ascertain the existence of, and as appropriate, assist in the development of advanced directives. So let's say I want to codify something from that. Okay, so I'm going to be using this. It is specified in the Texas Administrative Code. And so, okay, let's make sure we cite that. And let's say this ends up being right number 8. Patient has a right to specify an advance directive on, let's say, end-of-life care. Okay, now, the exact wording, that's not important here. But, okay, we have right number 8 here. Right number 8 is derived from a requirement in the Texas Administrative Code. So I have my explanation for that specific right, and I can expand on it. But for now, I'm just outlining. So I've got the basics there. I'm going to be referring to this, so of course I have it here. Can I be more specific about citing that specific language? Yes. Is it required? No. Just citing this specific rule is enough, because there's a lot of stuff in that rule. And given the length, only 300 to 500 words, you're probably not going to be doing much with quotations. That would eat up your space fairly quickly. So if you are numbering them and you organize it into your priority before you start working on the justifications here, then you won't have to go back and renumber them all the time. So there's a certain logical order of doing that. Now, you can also leave yourself placeholders here about which is the relevant thing. That can be as simple as having that, or just the Texas Administrative Code in this case. So that's a reminder that when you go down to start filling it in the explanatory section, that you have all your notes ready. So there we have it. We have a relatively concise assignment. You're supposed to create a list of 10 patient rights to be codified into a bill, organize them into a clear, logical order, and then justify why these ones. It has to be at least 10, can be a little bit over, but start with 10 and then see what space or if there are any conspicuous absences left that you want to address. Make sure to introduce the organization or context for the Patient Bill of Rights, because if you are, say, writing a Patient Bill of Rights for another country, there may be different concerns than if you're doing it in your particular state. And I would recommend doing it for a state that you know and plan to work in, because that will be most efficacious, the most helpful for your future endeavors. And that concludes our webinar for today. If you have any questions, feel free to send us an email at onlinewritingcenter@acu.edu, sign up for an appointment to get feedback on a draft, or visit the Writing Center website.